Hopefully y'all can hear us online. Give me a wave if you can.
They're just looking at you. Oh, no.
No one? Darn. Well,
Are you
we
really?
have audio. Yeah, it sounds like it should be coming through.
What's selected? So the hour.
It is indeed.
Yeah, first and foremost.
Can anybody hear me?
Yes. The answer is yes. Quiet crowd then.
Can we hear you? No,
Should be.
nobody's answering. Nobody's.
Can someone unmute and
I
say
can
hi?
hear you.
Okay.
Oh,
Just a quiet crowd.
I can hear you also.
all right, great. There we go. Sound test. All right, and we're recording now?
Yep.
Well, good evening, everyone, and welcome to our March meeting of the Oak Grove Community Council. We want to begin with introductions. So are there newcomers tonight from the community? If you've never been to a meeting, you're part of the Oak Grove community. Okay.
Anyone online? Online.
No. Do we have any newcomers online? Anybody that's here for the first time? Oh, okay, John, do you want to introduce yourself? And let it kind of say what part of the Oak Grove area or where not you live?
Sure. I'm John Duke. I'm from actually Oregon City. I'm from the Homeless Solutions Coalition of Clackamas County out of Oregon City. So
Okay.
come to hear how you guys are doing.
All right. Nice to have you with us tonight.
Thank you.
Okay, well, we'll introduce the board. My name is Valerie Chapman, and I am the chair of the Oak Grove Community Council. Our vice chair, Mark Elliott, is not here tonight, so we'll move to the secretary. And
I'm Joyce Johnson and secretary, and I live over by Rextown High School.
I forgot to say that I live a block away from the trolley trail over by on Evergreen Street. So, Dan is our treasurer.
I'm Daniel Bergrinside, treasurer. I live just off of Park Avenue up by the next station.
Hi folks, my name is Ben Cheney, member at large. I live up on Bridge Street near Snowberry.
So let's just go around the room and.
I'm Graham. I live on Evergreen, also near the trolley trail and the Knox station.
My name's Mary Brumbaugh, and I'm here from Clackamas County, and I actually live in Damascus.
Hi, I'm Catherine McMullen. I'm your elected county clerk. I live in Westland and serve the whole county.
I'm Tina Butel. I live on Park Avenue. Amanda Trujillo, in Midland.
Okay. We'll get all of you introduced when you're speaking. So, Linda, do you want to? Linda, do you want to introduce yourself?
Yes, I'm Linda Seals, and I live on Woodland Way, which is south of Oak Grove Boulevard.
And Tom? Tom Hammond?
Tom and Jolene Hammond. We live on Viewcrest off of Wallace.
Right. And Pam?
Hi, I'm Pam Horan and I live at Rose Villa.
Welcome. Sue?
Hi, I'm Sue Conahan. I live at River Road in Parkview Circle.
Right. Tom? Hogan?
I'm Tom Hogan, and we live on Oatfield Road between Thiessen and Concord. It's a house with a lamppost.
All right, welcome. And Jane?
Jane Civiletti. I live at Fair Oaks Ave and Oak Grove Boulevard.
Okay. Let's do some officer reports. So the treasurer's report.
So first, a correction to treasurer's report from last month. I had misreported that due to an error by the credit union, which has now been rectified. So the balance as of last month was supposed to be $18.74.51. At last meeting, we got $20 of cash donations, and so we're now at $18.94.51.
Doing as a part of your report on it.
And as usual, of course, we have our little cash donation box, which is where those donations came from. We're welcome to contribute as always.
Okay.
Joyce. And you can also contribute at oakgroveCPO.org.
The minutes were sent out. Were there any corrections or additions to the minutes other than typos?
Yes.
Yes, yes.
It's Pam Horan, and my last name is Horan, not Horgan.
Okay. Sorry about that. We'll get it done right. Any other corrections or additions? Then the minutes would stand corrected as they were corrected. So we have members from the fire department here tonight, and we're glad to have you. So I'm going to ask you to say your names for people and invite you to give us an update.
My name is Darren Washington. I'm a firefighter from Fire Department. I'm Ted Willard, and I'm the battalion chief in this area.
James Clemson, I'm an engineer. And I'm Nick McWine, the lieutenant trip for that.
Okay. And if you have a report for us, I'm going to invite you to come closer to the table
Yes.
and speak so that old
Yes.
ears can hear you.
Yes. I'll take a seat then. Well, thanks for having us tonight. It's nice to get out and see our community members. I was at the Linwood Neighborhood Association meeting the other day, and that was nice to talk to them. So a couple updates from the fire district. One is you guys love Operation Santa or what? You know what I'm talking about? The parade with Santa and all that. So we did that back in December, and we had our best year since COVID. So as we all know, things like since COVID have kind of dipped. And so we had the most donations, the most toys donated, and the most food. We received over 70 tons of food that we donate. So that was awesome. I think it's neat to see community groups like this get back going. I know it's probably been going for a while, but that dipped off during COVID, so it's nice to see that coming back now. So we're running a couple of safety messages right now, and as the weather's going to get nicer coming into summertime, we want to remind people to ride their bikes safely. So bicycle safety is one, and it's all the usual things that everyone's heard, right? So wear your helmets, wear reflective vests, don't go out at night, have a light, have a flashing red light on the back of your bike, all that kind of stuff. And then we're also highlighting fall safety. So just organize your home in a way where you're not going to fall, put grab bars up, things like that. So some other initiatives in the fire district right now, we are, this isn't necessarily your neighborhood, but we do serve a large area. And back in November, the citizens in Gladstone voted to fully become a part of Clackamas Fire District. So they've annexed in fully. And then we have a, it's going to be on the ballot in May out in Sandy. The voters out there are going to vote to annex into the fire district as well. So we'll see what they decide on that. So, and then I just wanted to highlight to this crew here tonight. How many of you remember the fire on Rupert back in August? You remember that? Mm-hmm. So this is the engine company that was there that day and helped pull those two individuals out of that house. So, yeah, I just wanted to highlight the good work that they do. So also, I do have a little bit of information on just some run numbers if you want to know how busy your neighborhood firefighters are. Let's see here. So Station 3, that's your Oak Grove Fire Station right here, is the busiest fire station. So we don't have the March data yet, but for February, they ran 238 calls just in the month of February. They run 2 rigs out of there. One is Rescue 303. They're not here right now, they're on a run, but this is the engine crew right here. And so Rescue 303 ran 204 calls last month. And engine 303 ran 77. So they are always busy. I'm sure you hear the sirens all the time. But that's a little bit of an update from the fire department for you.
So typically, what are those calls and how many might be fires and how many might be other kinds of things?
Yeah, so I'd say about 75% of the calls that we go on are medical related. So it's people that are, they slipped and fell. They could be having a problem breathing. They could be having chest pain, maybe having a heart attack or a stroke or anything of that nature. So everything that's in an ambulance, we also have on the fire engine as far as equipment. And so we're usually a little bit closer, so we'll respond and do that. And then the other 25% of the calls are rescues and fires. So car crashes up and down McLaughlin, we get, car crashes all the time at the major intersections. And then a couple times a month, we'll get a major fire. So similar to the Rupert fire, this one was really bad because there was people trapped in the building. So fortunately they were able to get them out, but we do go on a few of those a month, so. Yeah, so it's kind of a variety of what we do.
Yeah, it's impressive.
Yeah.
Yes.
Yeah. Is there any, does anybody have any?
I don't know if it's good that we're busy. It's just
Yeah, no, I think just, there's just in this community, we've got some apartment communities and, just, there's a lot of people. So, yeah, it's just dense, and so, just north of you guys in the city of Milwaukee, they're building up by the hospital, they're building some new, apartment buildings there too. And, it's funny because we'll look at those and we'll go, that equals more calls, more people equals more calls, because it's just accidents happen and that's what we're here for, to respond when bad things happen, so.
well, I'm glad that you're on duty.
Yeah.
So I have a question.
Yeah.
So, when you were saying that the fire trucks are dispatched
Mhm.
when they're closer than ambulance, is that what it is? So then is that part of what raises the?
Well, so sometimes. So, but we always will get an ambulance on the call as well. So the way that the ambulance system works is a little bit different. So we have our fire stations and we're kind of always at the firehouse, right, in the neighborhoods. So the ambulances, they work on what's called a system status plan. And so they're constantly kind of roving around, filling in the holes. So then this ambulance might get a call, so they'll move an ambulance over to kind of fill the gap, So that's why when you're driving around, you might see those AMR ambulances sitting on the street corners sometimes, and just waiting, and then they'll take off. Sometimes they might be going to a call, sometimes they might just be, be moving to a different area to cover. So, but yeah, we respond to supplement the ambulances and kind of provide that first response. So.
Other questions?
I have.
Yeah.
The killing it all with wildfires, or is that just a whole different kind of firefighting and stuff?
No, that is us. Yeah, that's us for sure. So, not so much in this area, we'll get little grass fires along the highways or maybe in someone's yard here. But we do cover all the way out to like Boring and south of Oregon City and outside of those areas. And we are very much a wildfire department as well. So, yeah, and we have all those capabilities. We don't have any wildfire rigs at your station right here because this isn't the neighborhood to have those, but we do have them all around in the area. So, yeah, absolutely.
So can I ask you to, do you have a card on your bike?
I don't have a card, but I might have one in the truck. Let me run up to the truck and I'll bring one in for you if I do.
Okay,
Yeah.
I like to know, who came. And
Yeah.
Keep track.
Yeah, we also signed in.
Huh?
We also signed in.
Oh, good,
Yeah,
that's.
yeah.
Well, thank you.
Well, thank you for having us.
Yeah.
Nice
well,
to
thank
meet
you.
you. Yeah, I'll go see if I have a card and then we're gonna probably jet out of here.
Okay,
Yeah.
all right.
Yeah.
Good to know who's on watch.
Yeah, absolutely. Yeah. Thanks again for having us.
Thank you. Thank you.
Right. So our featured speaker tonight is Mary Rumbaugh, and she's been with Clackamas County for 25 years. She's currently the Director of Health, Housing and Human Services, which is sometimes called 3H. So if you start going to meetings with Clackamas County, I find that they use lots of different abbreviations, and you have no idea what they're talking about to begin with. Prior to this appointment, she was the Behavioral Health Division Director for 9 years. She spent her entire career in public service with a focus on assisting some of the most vulnerable people in our community and advocating for system improvements, which we know how badly some of those are needed. She's also a Clackamas County resident and grew up in the town of Fulton, the thriving large metropolis of Fulton.
Yeah.
And now resides in Damascus with her husband and a cat named Bo.
Oh, yes.
All right.
One more set down there. I think we have enough. I think I might have gotten it right. One more second. Plus I already said that. So thank you so much for having me, and thank you so much. I was supposed to be here in January and got the flu. I never get sick, and of course I got the flu the week I'm supposed to be here. So thanks for your patience. I appreciate that. So when we spoke, there were a couple of topics that you all might be interested in hearing about. Certainly, the county is a large organization, so sort of understanding where health, housing, and human services sit. So I did bring, this is our organizational chart for this current fiscal year. This will be updated as we go into budget. Of course, we're in budget season. So really, I report to our county administrator, and our county administrator, along with our lead county council, our report up to our board of county commissioners. As you know, we have 5 county commissioners, and we're going to have a busy election season because 3 of them are up for re-election and all have opponents. So that's going to be an interesting time for us. As Valerie was saying, I've actually been with the county for 25 years, and for the last year and plus a few months, I've been the Health, Housing, and Human Services Director. We are the largest department in the county. We sometimes compete with the sheriff's office, but right now we have more what we call FTE or employees. We run about a $500 million budget across the 6 divisions that report up to Health, Housing, and Human Services. So within my administrative office, we're actually quite small. We just have 9 employees. Myself, 2 deputy directors, an administrative services manager who oversees our contracts and finance, and then for policy, plus an executive assistant. And then under that, we actually have 6 divisions. So that's what you see here. We have our social services division doing everything from intellectual developmental disabilities to veteran services to energy assistance. We have our children, family, and community connections. They're doing things like our early learning hub, workforce, job training, and also some veterans focus. Public health division, so we are doing immunizations and women and infant and children's programs, and really just getting, I like to talk about public health as a little bit of if you have been able to go to a restaurant and swim in a pool and not get sick. That's public health. That's what we've done. We've gone and done restaurant inspections and pool inspections. So about us when there are major issues, but then we get to silently sort of keep everyone really healthy. Our health centers division is our largest division. So they are what we call our federally qualified health center. They run our primary care, dental, and behavioral health clinics, both in Oregon City, Sunnyside, and out in Sandy. We have a beautiful new building out in Sandy. We actually just opened a new behavioral health, or had our grand opening for our behavioral health clinic over on Lake Road. So they are by far our largest division. They're also by far the largest primary care provider in the county, serving individuals who primarily are on Medicaid, Medicare, or uninsured. So in a really important part of our safety net. Our behavioral health division, which is different than our health centers, they're actually very outward facing. So they run our 24/7 mobile crisis response team. So these are individuals going out to respond to a mental health crisis anywhere in this county, as well as our 24/7 crisis line. lots of care coordination, what we call care coordination for really vulnerable individuals, many with severe and persistent mental illness who are in the state hospital. So there's a sort of a unique little division. And then our housing and community development division is technically our newest division. We've always been a housing authority, so that's a legal arm. So we've always been a housing authority, but with the Metro Supported Housing Services funds that were passed, well, not passed out of this county, but ultimately passed in Metro. So we receive a lot of supportive housing service dollars. So that's how we really developed and expanded our low income and affordable housing is through that. So it really sort of forced us a couple of years ago to create an actual, dedicated division. So that's us in a nutshell. So a lot of really, I don't think I said how many employees. We have over 800 employees, regular permanent employees. That doesn't even really begin to count all the volunteers, our volunteer drivers, some of our temps. So we are a very large department doing. Really, we like to say we're the helping department, and we get asked a lot to help. Right, Catherine? Which is what we do. That's our mission and that's our passion. So we've had a lot of projects over the last couple of years, including things like our Lake Road opening. The Lake Road was interesting because it's a large mental health and substance use program. We had 2 buildings up in Oregon City, and when the courthouse was built, they built it over where our buildings were. So they didn't take that into account, that they were actually demolishing clinics. So it took us a while to find a new building, and so it's been a couple of years of some instability for that group, but it's really great to now be, we're in the old Pamplin building. They've done a beautiful job. So we actually used to have a little bit more presence there, but now the courthouse is there. If you haven't been up to see the courthouse, it's really a beautiful building, and it should be, because it cost us a lot of money. So, but it's fun to see. So, we try not to have too bad of feelings about the fact that we were displaced. So we have a lot of projects. Most recently, we just opened at the end of last year. We opened over off of McBride here in Milwaukee, the Crisis Stabilization Center. So before I get into the recovery campus, I just want to highlight that program. That's again a county-wide resource for anyone either experiencing houselessness. So we have a short-term up to 60-day program where somebody can just sort of be more stabilized, get connected to resources. But the other part of the program is a complementary program called the 23-hour Crisis Stabilization Center. So individuals experiencing a mental health crisis coming to the attention of law enforcement or our mobile crisis response teams can actually be brought there instead of jail or the emergency room. And they can stay up to 23 hours and 23 minutes. That's sort of what the state rule is for that program. And it's been a really successful, we're still early on, but really successful intervention for folks who they need just a little bit more. We stabilize almost 80% of individuals right there in their home, in their community, but there's about 20% that just need something a little extra. We really don't want to be using emergency rooms, and we certainly do not want folks with mental illness having to go to jail. That's not really where people get better. So that's been a really exciting project that finally opened their doors at the end of last year. But as we have been promoting our board of county commissioners, one of their strategic goals and their commitments is around what we call a recovery-oriented system of care. And a recovery-oriented system of care is really a continuum of services where we're just meeting individuals wherever they are at, right? So we don't want to just create one thing. We want a continuum of services. And that includes things like our Lake Road and our stabilization center. So there's different entry points for people who are struggling with whatever that might look like. So your handout, if you want to move to the next attachment, your handout this is pretty hot off the press. So this is our Clackamas Recovery Campus. We're over off of 92nd Avenue. was a previous charter school. It was actually property owned by the North Clackamas Parks and Rec District that we purchased back in 2024, a little over 6 acres. What you see here is just a portion of what the 6 acres will be. So we have 2 buildings called the Recovery Campus. You'll see here on the left at a glance what they'll contain. So one building actually has will have what we call withdrawal management. Generally people call it detox. And so we have 16 beds, and then we also have in that same building 24 substance use residential treatment. We have no residential treatment for substance use in this county. So this is like the first that we've ever had, which is amazing. The second building will actually have 36 beds of transition, 36 rooms of transitional housing, plus outpatient, plus job training, plus peers. And this is what we know about continuums of care, especially regarding people struggling with substance use, is that we can get them treatment, but if we don't actually get them sort of that recovery transition time, transitional housing is actually key. It's what allows us to move people really through the system a little faster. Because what happens is if we don't have sort of the next step, people stay longer in residential treatment. So Oregon actually has a much higher length of stay than other states because we haven't sort of built out that transitional housing, sort of transitional recovery housing. So this is really like a model that is really best practice. So it's really great that we were able to really design it in that way. So the county we are building the buildings, and there will be our buildings, we'll own those buildings, it's our property, but Fora Health is will be the operator of the programs. They have a beautiful newish program over off of by Adventist Hospital called Cherry Blossom. And so they're just well known. If you know any recovery at all, DePaul, they used to be DePaul. And so they've been around for a really long time, but they have a new name. We have, like any project, this is a $44 million project. That's just for building. That's not even considering operating. So it takes a lot of mix of dollars. John Duke is here on this call, and he's also lead on building a really important program called Caring Place. And it just takes a lot of innovative blending and braiding of funding to get there. But we were lucky most recently to be awarded a federal earmark in the amount of 2.5 million. We were also granted 10 million from the governor's office to support the transitional housing under her continued emergency order specific to houselessness. And then we are also gonna receive out of this most recent short session, sort of what they call the Christmas tree bill, 5 million as well. So we were at a point this last fall where we really had enough funding for the first building, which would be withdrawal management and residential. And now we sort of said to the board, we can't build the second building without knowing that we have the funds. And through just some advocacy and probably just some grace from somebody, we were actually able to get the remaining funds. So that's amazing. It feels like we can actually now really move full steam ahead. And then while we're also then, working with the neighborhood, we have a good neighbor group. That's really, really, really critical that you're always partnering with your neighbors. The businesses, there's not tons of residential, but there's enough. Because there's a lot, there just remains a lot of stigma related to folks who are struggling with substance use, folks who may have unstable housing or no housing at all. And so there's always going to be questions about safety and crime. And really what we know is that actually when you build programs like this, actually if they get safer in that vicinity, because people are actually they're not gonna sort of do bad behavior where they're actually getting their supports. Now they still may do bad behavior, but they're probably going to do it like a little farther away. So we spent a lot of time, and we're going to actually be hosting in the beginning of June a community a larger community meeting, just so that we continue to be engaged with the businesses. Anyone who would be welcome. We'll have some beautiful, the design boards and things for, and the commissioners will be there to answer any questions. So we'll break ground in July. End of July, we're breaking ground, and we would expect completion of the project toward the end of or fall of 2027 if everything's on track. Yeah.
I just have a question. So the 44 million is for building home run.
Yeah.
And when you were saying the county and the state were pitching in also, those were the only other two entities? Or did you mention one of it?
So we received a federal earmark, so the federal government, and then on the at a glance, there's a couple of different, we've received a couple of different, but as I said, you have to sort of braid all of it. So some of the COVID, what we call the ARPA funding, we used that to actually do the purchase. We also received opioid settlement dollars. Some cities also receive it. The county receives that, and that's how we'll have to take out a loan, and we'll be paying that loan back with opioid settlement dollars as those come through. That's an 18-year settlement that we're, 6 or 7 years into. So it's really a mix. We also have some of the supported housing services dollars are actually also going into to make up that 44 million.
And then the running of the facility.
The running of the facility, folks who are covered under insurance, so they'll obviously take Medicaid or in health plan. They can take Medicare, they can take commercial insurance. And then we have small contracts, small amount of funding for folks who are uninsured. So operations are generally, it's a what we call a billable service. It's covered under insurance. Yeah.
I'm trying to figure out, okay, so the 44 million paid for the buildings. Where does the operating funds come out of? I mean,
it's insurance. The provider will bill insurance. So most people are covered by, well, for now, they're covered by insurance.
Okay, so there's insurance for care, but to have the buildings, there's building costs.
That will be covered by the county.
That's what I wanted.
Yeah.
Okay, so where and how much is the operating cost different than the buildings and the services? That's the operating.
Yeah, I don't have that dollar amount. I mean, we know we know there's a square footage cost for things like our facilities use that includes like utilities. I don't have those dollar. I've been so focused on the capital piece of it, but yeah, the county will, because there are buildings, the county will have to continue to maintain them, including paying for all the utilities. So the operator for a health will get their revenue covered by being able to bill insurance for people who are coming into care, but the county will have responsibility for maintaining the rest. And then we still have acreage that is undecided as well. So this is only taking up a portion of the 6 acres. We have to hold an acre for community space. So we haven't yet decided with the community whether that's a community garden, whether, what that might look like. But then we actually still have 2, maybe almost 3 acres that are sort of unscheduled at this point. Frankly, we don't have a budget, or people might have great ideas, but we don't yet have any money for that.
So unless there's another question, I'm gonna ask more questions if I can. I have a background of working with folks, and that's why these questions come up. Florida Health. How do they pay their people? Are they well-paid employees?
Well, we have language in contract that requires them to pay them a living wage. And Fora really they're a good provider. They have a good workforce retention, with the reality that we have not been like in medical, we have struggled with the workforce. We lost quite a bit of behavioral health, so both mental health and substance use workers through COVID. Because they were still working through all of that. And so that we'll have, this is actually some of the same questions that the commissioners asked. So we'll have very clear deliverables and outcomes in the contract, both client outcomes, but also things like workforce retention. If we don't have a workforce and we can't serve people, we'll have a problem then.
Right,
Yeah.
I mean, I think, and for people who've been involved in this, know that years ago, we had big facilities, and then we went to small
That's right.
facilities. And we went to small facilities because big facilities are hard to manage. And they're harder for staff working there, and if you don't have really well-trained staff and good staff retention, then you have a larger problem than you would have at a small facility,
Yeah,
right?
absolutely.
So I guess my questions then is long-term, you know, how, given the issues around, retention of employees and good paying jobs for healthcare people at this level of work,
Mhm.
how, it's just a guess that we're gonna make it work again this time. I mean, what
Yeah.
are there any new strategies in this time around of building big things?
Well, and what I would say is this is actually not a big building.
No.
When you look at Cherry Blossom, they are double, if not triple the size. They
Right.
have, I think, 48, residential bed. I mean, so we're actually somewhat small. I think we're pretty manageable for that reason. You know, legislatively, the state has continued, in fact, I was just on an email today, the state has continued to say, how do we incentivize this particular workforce? And frankly, a provider like Fora, who can actually get dollars from the state legislator where they can actually pay like bonus or hiring bonuses. The county, we can't do that. And so that's actually a reason for us not to be the actual provider. We could have chosen to be the provider and deliverer of services, but we're just really, really expensive. Not expensive based necessarily on salary, but all the indirects that are part of who, that sort of allow the county to run. So, there continues to be just really key focus on the behavioral health workforce in particular and additional incentive, whether it's covering people's licensure supervision so they can actually be licensed. And again, these kind of sort of retention and incentive bonuses. So a provider like Fora could actually push those dollars out much easier than like a county run program. So I think there continues to be a commitment and awareness both at the governor's level as well as the state legislature that we are still underfunded historically within the system. We can't take our foot off the gas. We have to continue because we are bouncing back better than we were a couple of years ago, but it's a real, this is hard work. It's hard work, yeah.
Yeah, and I mean, I want it to be successful.
Absolutely.
And when you put $44 million into buildings.
Yeah.
And a large campus.
Yeah.
Then you really want it to be something that actually is gonna work for people.
Yeah, absolutely.
And if the employees are a real key part.
Yeah, yeah, absolutely. Yeah, workforce retention is huge.
And well-trained people.
Yeah, absolutely. Yeah, yeah.
I've worked with the Nami Clackamas County, and I'm curious about the interaction and your flow of the work between the nonprofit and.
Yeah, so the executive director of Clackamas County, Dave Hunt, is actually on our local mental health and addiction advisory board, so he's well versed in what we're doing here. So lots of partnerships with nonprofits, community-based organizations for sure. Yeah.
And what is the number of beds for detox and the?
16, 24 for residential and 36 for transitional.
Okay.
You'll just be able to take notes from this, yeah.
Yeah. Quite a demand is there for the level of service you're providing either now or in the future.
Yeah, that's a great question. There's been a lot of sort of discussion about, have we right-sized it? Are we like do we have too few? Do we have like too much? Interestingly, Fora Health has more withdrawal management beds than we do, and they actually have access. And that's part of what is the challenge is a little bit of the need for on-demand, that at that point that somebody is ready to get treatment and go through withdrawal management, we have to be able to give them a bed immediately. Because if we're not able to do that tomorrow, we might have lost them. So it's been really a head scratcher lately about why there continues to be capacity for really that front door. So we sort of made our best guess on what we know our population in this county to be, the number of people. We have some data through insurance companies about individuals with substance use who have at least had a touch point with maybe outpatient, or they showed up to the emergency room because of a substance use diagnosis. So we sort of did make our best guess. We think it's the right guess. We didn't want to overbuild it because we can't make money. We can't cover costs if we're sitting with empty beds. So I think we've right-sized it. We also, as much as our priority will be Clackamas County residents, the fact is we, because of the way that insurance works, if somebody in Multnomah County and we have a bed, they can come and get services from us, right? So in some ways, it's really a tri-county resources. I don't expect a lot of Multnomah County necessarily, or Washington County to come, but Multnomah County, we're close enough to them that we might end up finding ourselves with some of those residents, just for the treatment part. Yeah.
So it mentions that, the referrals can come from a lot of sources. I'm kind of curious what that mix is now and how you see that.
We would expect most of the referrals to be Morgan Health Plan or Medicaid enrolled members. But certainly, Aurora is on commercial insurance, so Providence, Blue Cross Blue Shield, MODA, and community-based organization, peer organizations, our own county care coordination teams who are working with individuals struggling with substance use. They will absolutely be helping get folks, to this campus for sure.
So these, the way that it'll work, because it's not, like in a business district, or it's not a place where we get transportation to and from. So, when folks are there, are they, free to come and go?
Not when they're going through withdrawal management, residential treatment, this is really voluntary. People are voluntarily being there. You're only withdrawal management like 5 to 7 days, but once you're in residential, you will have some freedom to go. And then of course, once they're in transitional housing, they're getting treatment on site, but they may also we may be hoping to, help them get a job, and maybe they have a part-time job or they're going to the college for some classes. So that's been some of the conversation with the community, which is, are we gonna have a lot of extra cars? Are people actually, driving themselves? What about safety if there's not great sidewalks there? What about just safety of people walking to the bus? So those are all things that the Good Neighbor group are really sort of grappling with how do we both keep the participants healthy and safe, and then how do we also make sure that the neighborhood is safe as well, because people will be able to come and go. Yeah, I do see that John's got his hand up too.
Yes, I just wanted to just sing praises, basically. 2 years ago, the county put out a report about the distance between the need for substance abuse treatment in our county and the services that we had available. And that was a time when it established the county commissioners and the administration said that they wanted to form this recovery-oriented system of care. And so it was a vision, it was a need, but so often it doesn't come to fruition. And here it has. And I was completely excited and ecstatic to hear that it was very complex, but you braided all the funding together, and now you have this beautiful plan. You got the land you found a location. you have a provider. It's really quite remarkable. It's a big need all over the state. We're one of the most challenged states in the country around substance abuse treatment, and now Clackamas County is leading the way. And I just want to say it's great. I'm really impressed.
Thanks for your support, John.
I have a quick question.
Yeah.
About Behavioral Health Division. There was a problem for some time about police calls and not being handled well enough with no companionship that would be able to help address the client.
Yeah.
The person in trouble.
Yeah.
Is that part of the behavioral health?
Yeah, it is. So, for a long time, the model was actually embedding, mental health clinicians with law enforcement. In Clackamas County, we actually had a team of folks who were actually, embedded with the sheriff's office. The state really moved away from that type of model because of, sometimes, responding with law enforcement can actually escalate a situation that is unnecessary. So the mobile crisis response team actually responds in pairs of two people. About 30% of their calls, I just happen to know this because I just got some data for them in 2025. About 30% of their calls did have a co-response with police, because a determination had been made that there was maybe a safety concern. So, and as you may know, some of our cities, so Milwaukee, Canby, Oregon City, Westland, Lake Oswego, and Molalla have embedded mental health clinicians actually as part of their police department. They call them behavioral health unit. So that is different than the county. So they're only just responding to their jurisdiction, where we have responsibility through all of Clackamas County. So we've gone up to Mount Hood. We had a timberline worker who had a mental health episode. So we're up literally in the snow addressing mental health crisis. And then we're here in your community, we're in Oregon City, wherever we're going. So there will, as much as the state wanted to adopt, and certainly other advocacy groups did not want to see police sort of co-responding with mental health, it's just not always realistic from a safety perspective. But we have a really great working relationship, in particular with our sheriff's office. Sometimes we're a point and they're a block away. Sometimes they're a point, we're a block away. And so, it's a really good working relationship so that we can really keep the community as safe as we can be. Yeah,
Thanks.
yeah. A couple of things that you also wanted me to talk about, if you don't mind. So as much as the recovery campus is really, really, really exciting, we are also in a pretty challenged revenue time. So we are, while a lot of our revenue that we receive, so my overall budget is primarily $500 million. Majority of it is state and federal funds, and some local funds, like through our sort of what we call our coordinated care organizations. They're really the Medicaid health plan. Only about a little less than 3% is actually county general fund. I get very little county general fund, and that's okay. But our challenge right now is that a lot of the funding, we've lost some of the federal funding, some through housing, some for some social service focused areas. The state funding, as well as the local funding, is either reduced or it's just flat. And as you all know, flat funding in the real world is really reduced funding, right? Because the costs continue to go up. So employees get cost of living increases, there's increases to utilities, there's increases to allocated costs. So we are in a bit of a challenging time. We are really trying to be as tight fiscally as we can while we're not impacting services to the community. But in the fall, we saw a couple of contracts be eliminated. So we actually had quite a few layoffs. We ended up having to eliminate 29 positions. Coming into this fiscal year, we have 11 positions, that we are unfortunately having to reduce, like 11 filled positions, and we have about 70 vacancies that we can't, they just have to go away. So it's as much as there's a really exciting things happening, there's also just some hard reality. We're also expecting some big impacts to the changes to Medicaid eligibility, redetermination, work requirements for folks who are on the Oregon Health Plan that we believe, starting, toward the end of this year into 27, we'll see more people fall off of insurance. And, that does mean that the county is really the safety net for them, but that doesn't mean there's any additional dollars to really support that. So we are, we're doing a lot of work around sort of how are we structured, where can we align similar programs so that we can work a little more efficiently. But that is just a reality right now, unfortunately. So we're doing the best that we can. I would also just say that the federal government we'll get a notice, this happened last fall, we got a notice that literally effective that day, we immediately had like millions of dollars cut. They were just cutting the program. Less than 24 hours later, they said, just kidding, we're reinstating it because lawsuits were being filed.
Yeah.
But and so I sort of initially just said, don't panic, like let's just wait and see what happens. And sure enough, the next day we get the next notice that says your funding's been reinstated. That does not create, that does not help people. That does not help workforce retention, right? Because you're like, is my job safe? So some of that, it's not settled down now, but that is the kind of pressures, that we've been under. The other question that we talked about was really like, what advocacy role can this community council have? And what I will say about our current board of county commissioners, and I'm not saying the previous board wasn't like this, but I will say that this board, they listen. So I have to be in front of the board a lot. So if you really like to hear my voice, watch the issues and business meetings. But at their Thursday business meeting, they flipped it so they hear public comment first. It used to be that they heard public comment last, and often they didn't have time or they cut people off. And they hear public comment first, and that public comment has actually resulted in maybe items that they were gonna just move right through consent. They'll actually pull for further discussion. So I just want you to hear that this board really does want to hear from our community. And I've been really impressed. I mean, I will tell you, sometimes the items they pull is really frustrating because we're so close to getting it voted on. But it's because they're like, okay, like we need to take a moment. We need to understand what the concerns are. So I just want you to hear, do pay attention to what is on their agenda. You don't have to be there in person, you can call in. But they really do love hearing from the community. And I do feel like they take it to heart. And I can't say that previous boards I always felt like that about them. So I just wanted to say that's where I really think your advocacy could be.
Okay, cause I think, I have some personal connection with, child that was a counselor working during the recession for Clackamas County. And behavioral health counselors' loads were so heavy that, I mean, it's hard to explain, unless you've worked in that field, how complicated that is. Because they can't give the care that people need, and yet they keep piling on more cases. And so I worry about that when I hear about, cuts of any kind and how well funded. So if we were going to advocate, which area would, because I think I mean, I brought this up before, I'm concerned with recovery camps. It's in health and human services, it's your staff that takes, so much.
Yeah.
And if you don't have enough staff, that doesn't mean the number of people with needs drops.
That's right.
It means that their caseloads keep.
Yeah.
You know, so is that an area where voice matters, or do you think that?
Yeah, I mean, the board has, budget authority, and so I think, at times of scarcity, I don't think we're quite there yet. Although, do pay attention to what's happening with the sheriff's budget. Obviously, the bond will be pretty critical for them moving forward. And the board has to, and the budget committee will have to make some hard decisions when it comes to dwindling, resources like county general fund. And I think, again, we probably, Health, Housing, and Human Services may have not always done ourselves favors because we've always figured out how to sort of fill the gap. I think more and more we're sort of saying, like, for example, let me give a great example, measles outbreak. So we have yet another measles outbreak. Well, if we're gonna really get in front of measles outbreak, we have to be able to get out there and do, vaccinations and, connect with folks. So you can manage to 1 or 2 outbreaks that we're sort of budgeted for that. Beyond that, we don't have the funds. And so really being able to sort of advocate and talk about the scarcity of funding. Now, frankly, the state should be able to pony up, right? Because we're really doing that, sort of under our role as the local public health authority. And so, like, those are the opportunities. So if you're aware of sort of a need in not only your community, but what you're hearing across the county, I think those are the places to say, hey, I just want to make sure that, Recovery Camp is a great example. You've got funding for the recovery campus, but I want to make sure that you can continue to keep the lights on, right? When all is said and done. And so I think those are the opportunities. What I experience is that a few people bring up similar topics, and then all of a sudden the board is starting to pay attention to, like, oh, we did all this work to get the 44 million, but what's our ongoing operating, right? And so that, I think that's the opportunity. So.
Other questions that people are?
I did. So when you're talking about the 29 positions that were lost historically, now are you talking about what positions are these? And there's 11 more upcoming and 70 positions cannot be refilled. Who are these people? What are these positions?
It's a mix, some out of our public health. So we're about as lean as we can be on some of our public health response. Some of it is really just administrative. What we do is we eliminate managers, where we can. We eliminate administrative support, which if you've ran any kind of business, like you want to keep your worker bees, right? But if we can't pay the bills or we can't get the contracts through, so you can sort of lean out too much. But we just don't have a choice. So we've had a look at, again, it's primarily administrative positions. We'll have a little bit of clinical switching around. The state has sort of within our behavioral health division that you were talking about, they have refocused some of their funding based on some other different priority populations. So we'll still be able to serve the priority population, but the people who maybe have been doing work over here are now going to end up doing sort of work over here. But the way you have to do that is you have to actually eliminate positions to then have them move into other positions. It's a little complicated, but that's just, that's just the reality. And we're just losing enough funding that we just don't have the safety net to be able to keep funding positions through like fund balance or things like that.
And what I hear you saying is so that your people that are working directly with people are taking on some of the paperwork, which changes their
Absolutely.
ability to work.
Yeah.
Which is, that's the kind of concerns that
Yeah.
I end up feeling when
Yeah.
we're,
Yeah,
This is very exciting
yes.
and also it's very bleak. We are in bleak times.
Yeah, you know, I talk about this, John probably has heard me say this too, I feel like we're almost like 2 years too late. I mean, had we really envisioned this 4 years ago, where really during the pandemic, the, you know, state legislators' eyes were really opened wide about the impacts of mental illness and substance use in this community, and money was just, whew, they were flying money. They have more money than they knew what to do with. I mean, we saw historic investments that we never saw. We were a little late to the game. And so by the time we were sort of ready to say we're moving forward, we were like, are there any pennies in the, you know, in the couch cushion? So the fact that we were able to cobble it that in this way is actually pretty impressive. But you're absolutely right. You know, I think it's still the right thing to do because the need is still so great. But we will have a little bit of uphill battle.
other questions? Mary, thank you for
You're
your,
welcome. You know how to reach me if you have any questions, so.
I know how to find you.
Yeah, you know how to find me. Come look, don't go to the courthouse, you won't find me at the courthouse, but I might see you walking, so.
So thank you for
Yeah,
all
thank
of
you
sharing
so
the
much.
information and being willing to come, and we're glad you recuperated.
Thank you. I don't know if I throw this all scratchy from talking too much. Thank you for all that you all do. I mean, it's so important for your investment in your own community, so. Thank you to the clerk of Poland for actually coming. She really wanted just to be my support system.
Everybody.
Absolutely. I was like, I love to see you there, so. You're very kind, you're very kind. Well, I will excuse myself if that's all right. So thank you, everyone. Take care of yourself.
Okay, well, we may have, a shorter meeting than we usually have. We don't have, Joseph is not with us tonight, for any kind of land use. And the backup was, supposed to be Bob Bohannon, but he's not here either. So we don't have land use, tonight. I did have a conversation with Joseph, and he said that really what's happening, and we used to get a lot more things referred to us, but some of the changes in, zoning and, requirements for middle housing, et cetera, change, some of the projects that we were looking at. So there's a lot of things that, they come through, and if it's all according to current code, then there's really nothing that we can add to that. I mean, sometimes there's a, you know, a question about, you know, access or an access road or something like that, that we have an opportunity to weigh in on, but other times there's not a lot, not as much in there. So, Joseph can, fill us in when he's back. Committee reports, Wayne, do you, we're glad you're here.
Thank you.
Do you have any information that you want to share with us about, I know you've been working on thinking about candidate forums.
Right, the, 11Q is been organizing for quite a while now, two candidates forums. But I think there are like 25 candidates, it's the most number that they've ever had, and
Right.
And to try to set up a forum is rather difficult, so they will be setting up two forums. One that will be on the 18th of April, and the other one on the 25th of April, which are Saturdays. And they will go from 10 a.m. to 11:30 on one date, and they will be, I'm not sure how they're operating. I don't know if they know everything yet about how everything is going to be set up. But the reason that we couldn't go on the campus there was that we've actually been closing building down because we're going to destroy a building this month. And people have had to move out with all kinds of stuff. And, so, they've got, it's just too much going on. So anyway, we can't get there. So, they agreed, the administration agreed that they would broadcast the forum, the two different forums that we're on, which we could be viewing here. But I also looked into the larger facility at the United Methodist Church that's down the road down here. And I approached them with the topic, and they're in favor of having us there for a larger event. And they actually have their own system that's set up there very well, a similar Zoom system, but they have a brand new one, and they've been training volunteers for some time. So they would be able to handle our needs. And the representative of the church basically said to me, it's a community activity. We do think we have to charge some fees in order to cover the services taken on by volunteers, which are now almost staff, and we get on board, but we certainly will not make any efforts to make any big cost. It would be very minimal cost. So I haven't gotten the final word back from them, but they're more than interested in working with us. So if we wanted to expand our group so we can have another 100 people or more, we can, the Zoom account can handle up to 500 people. So there will maybe at least be 200 people that will have a view, or maybe more, I'm not sure. And if we're interested in trying to expand it into the use of the Methodist Church, they're more than willing to work with us. I just don't have the final agreements and figures at this particular point in time.
Yeah, no, it was pretty startling. I actually had a meeting with one of the commissioners 2 days after the filing date closed. We had a funny exchange. I said, "Oh, it's going to be kind of an easy." And they go, "Oh, everything changed," So they have all these,
In one day, it changed.
all of them. They all went in on the last day. So I think there's 4 people now running for position 2, which is what Commissioner Savas has, and 3 for the position that Ben West has, and 7 or 8 for the position with Diana Helm. So that's just the commissioners. So it's
And apparently
it's a big deal.
broad range of political thought,
Yeah.
expensive, it's just
Right.
amazing.
So what we can do, if people are interested in, as a CPO, we've never sponsored candidate forums because we're nonpartisan here, but we're all members of the community and we're all interested in what's going on. So Willamette Views offered to let us participate with them as way, and as soon as details are locked down, then I can send an email out to everyone that would be interested in participating in it. And if they can go in person to someplace or just Zoom in, however that works. So
Yeah,
we'll work that out
Yeah.
so that people have an opportunity to see all these people that came out of the woodwork on the last day. So great.
And otherwise, people won't have any chance really to understand who they are.
No, I mean, it's such a short window now to the primary, so that's very interesting. Okay, thank you, Wayne. The other meeting that I'd like to report on, and I had hoped not to have to do this report because I hate hearing myself keep talking, is at the DAC meeting, the District Advisory Committee for NCPRD. So I actually went to the last DAC meeting, which was good because neither one of our sub area 2 people were there.
Oh.
But Vanessa Dane Slagle, who often is here, was there. And I was hoping she could do this report, but she's gone spring break too. And there is with the next voting for that fills open positions, they are going to at last have alternates. And if there had been an alternate already, then when both of our 2 people couldn't be there, there would have been at least a 3rd person that could come and participate in the meeting. So, and Vanessa has already indicated interest in running for that. So, and I'm hopeful that she can do that. So, as you can imagine, having just heard Director Rumbaugh speak, there is a budget shortfall that's going to also affect the North Clackamas Park and Recreation District. So there were a lot of cuts last year, and there are more cuts coming. But Kia Sully, the director of NCPRD, said that no personnel is subject to be cut, so they're not going to lose any more jobs. And the way they're going to do the cuts at this point, the things they're looking at are cuts to maintenance, a longer break between the summer season and the start of fall, so things would kind of close down more in between those times. So they're looking at ways like that to save money. They have a consultant that is working with them, national consultant. I'm sorry, I didn't write down the name of that group. But they are volunteering their time with the MCPRD, so they're not paying for the consultation. And to determine the feasibility of putting a measure on the ballot in November to raise the tax rate base, or to somehow, I don't know, or a bond, or however that works, whatever it looks like it might be feasible to put on the ballot measure. So that was a big part of the conversation. And I wanted you to hear this report tonight, because next month we will have representatives of the NCPRD coming to talk with. So this is just helps us to know, kind of what's going on there. Also, there had been a court case about whether or not it was possible for the city of Milwaukee's city councilors to vote to withdraw Milwaukee from NCPRD. And that had been going on for some time. And the effect of that, the decision out of that was that yes, they could leave NCPRD if they chose to. If they choose to leave, then there's language that says that because they are 20% of the district, they would receive a check for 20% of the assets that had gone in. And if anybody was around when Happy Valley pulled out, you understand the angst that many people feel about a second group pulling out. Okay. So I'll just say that whole decision put kind of a shadow over the DAC meeting last month. And I know a lot of people are doing a lot of conversation and want things to work out well for everybody. But I guess this is my own personal opinion. I think it's very complicated for an unincorporated area to be in an organization with, like NCPRD, with cities that are incorporated. So just, if you think about it, every subgroup does a report at the DAC meeting. So sub-area 2, there's a report. There wasn't one from sub-area 2 because we weren't represented, but sub-area 3 representative and sub-area 4. And people are volunteers who come from the community in an unincorporated area, and maybe they're having a meeting or something like that. And then when you get to the sub area that is just the city of Milwaukee, it's the mayor of the city talking about all of the things that they're doing in their part. And it's a whole different, so that it's kind of it's very interesting, I'm gonna say that. So we don't know they don't know how all of that's gonna turn out. So I look forward to hearing from NCPRD, and we know that they're concerned about budget and whatnot. And I'm gonna do a little update on the Friends of Oak Grove, their funding that they've been doing. But first I need a break, so I'm gonna do that. Yeah, he said he'd like to talk about.
Yeah, I have one item of interest, probably to everyone here in the entire state really. But as you might know, for the past probably more than a couple of years, there's been some work towards getting a universal health plan for the state. And so I believe it was last year, the legislature formed a sort of semi-temporary state agency, the Universal Health Plan Governance Board, bit of a mouthful. But they are working to create a plan for what a public healthcare plan could look like, and they're going to deliver that by September to the legislature. And so they meet every month in Salem, and they take public comment and things like that. But what they haven't done yet, what they're about to do, is some like public outreach kind of out in the communities. And so they're going around the state and they're going to do town halls. Not just them, there's other groups that are involved with it too. It's like a collaborative effort. But they are doing one fairly close to us in Oregon City on April 9th, 6 to 8 p.m. at the Unitarian Universalist Congregation of Willamette Falls. And a very easy way to find that is a very short URL for one of the organizations that's hosting it, which is Healthcare for All Oregon. That's hcao.org. So if you go to hcao.org, you'll find information. If you just scroll down the page a little bit about those town halls. There's several of them, but the one closest to us is that one in Oregon City. So I think it'd be kind of interesting to hear about what they've been working on, and they'll take comments from the public. I believe we'll also have an appearance from our state rep there, Mark Denbo as well.
Where is it coming?
At the Unitarian Universalist Congregation of Willamette Falls in Oregon City.
That's a mouthful.
Yes.
You do scare me, and I think it's right.
If you go to hcao.org, you'll visit it.
Church.
I think so. I haven't been to it.
Okay.
Yeah.
It's probably a big church.
Pink,
Oh, pink.
across from the library. I think.
Yeah. Yeah, it's like on the other side of
But I don't know all my churches.
Yeah, I think that's the only Unitarian church in Oregon City.
Yeah.
So, yeah.
So I'm putting on a different hat right now, speaking with Friends of Oak Grove Community Council, which is a nonprofit that is sort of connected. They help fund the Oak Grove Community Council, but they also can help fund otherwise. And they have been working on funding the drop-in program at the Concord Community School, and so there is I want to say a pot of money that will be going to NCPRD, and they will use that to keep the drop-in program going, but more money is needed towards it. And there is going to be an effort to approach the business community that we're working on right now. But I just want to say that I left some envelopes and information on the table back there for people that might be interested in donating and continuing to donate to that fund. I had the opportunity today to be up at the library, and I have to say, if you haven't been there during the day when all the kids are in the park,
Well, it's always busy.
oh my God, you have to go, because when I think about what was there before and what is there now, it's totally amazing. And the community center is running, but it's running, I want to say it's only a fraction of what it could be, because there is so much more to the building when the funding is there. So it's worth it as a community to keep funding that center. It really is right in the heart of our community, which is why we named the campaign that. So that's kind of my pitch, to keep people interested, and there are envelopes on the table, and online people can find us at Friends. There's actually a link from the Oak Grove Community Council website. Anyway, so I'll work on it. So do we have other announcements or public comments, things that people want to say for the good of the whole or whatever? Yes. Yeah.
I can provide a quick update on elections if that's okay.
Yes.
So yeah, I'm the county clerk for Clackamas County, so I run our elections. We are gearing up for the May primary election right now. As you mentioned, there's a lot of candidates that have filed for county positions. We had 19 candidates filed for positions, including 15 for 3 commissioner positions. And the candidate statements are actually on our website right now, that are gonna be part of the voters input. I just did all the copy editing for 74 measure arguments, and those will be on our website shortly too, and then those will all go out in the mail. Starting April 22nd to every resident's household, so that'll be. The measure arguments will be available soon, the candidate statements are already on the website. Yeah, I'm expecting the measure arguments to be up on Friday, so day after tomorrow. And then we're designing the ballots right now. Your ballot's gonna look a little bit different. We upgraded our ballot tabulation system, so we're using the same tabulation system that 70% of the rest of the state uses. It includes Multnomah, Washington, the Chutes counties. And so that'll actually make it easier for us to process ballots, a lot less manual work when it comes to having to do duplications. Like now, if you spill coffee on your ballot, we're more likely to be able to just scan it right through where before we would have had to have duplicated it.
This is good to know.
So looking forward, as an election nerd, I'm looking forward to this election. The ballots are going to go in the mail, October 29th. So the voter registration and party choice deadline is the day before on October, did I say October?
April.
April 29th. Sorry. April 28th is the voter registration and party choice deadline. And then election day is May 19th. We are recommending that if you're going to mail your ballot, that you put it in the mail a week before election day. The US Postal Service has changed how they're processing mail. So postmarks aren't necessarily put on your mail the day you put it to the mail. And we want to make sure we can count every ballot that's validly cast. So put it in the mail a week beforehand or drop it off at an official ballot drop site. There's one at the Oak Lodge Library and Concord Community Center. And of course, if you have questions, please reach out to myself or my staff. I see our website's up, a lot of good information there. I will be on the ballot for re-election in November, because I only had one opponent file against me. We automatically will go to the November election. So you won't see the treasurer or the clerk on your ballot until November. Yeah, thanks for that.
So are all the elections offices in Oregon nervous in case they actually pass a bill that says we can't have mail-in ballot?
So how elections are run are determined by the states. And so if Congress were to pass something that said that we couldn't use vote by mail, then that would probably become a legal issue. I don't see anything ahead of us. The Save America Act is something that people are talking about, but there aren't the votes for it currently for it to pass. It's causing concern, but I don't see it changing our law here in Oregon. The one thing that did happen this week, the Supreme Court heard a case about whether or not postmarks can count. So in Oregon, if your ballot's postmarked by election day, but it doesn't arrive on election day or arrives within 7 days, then we're still permitted to count it. We do count it. But the Supreme Court is hearing a case if that is still valid. If we could still count it, it's received after election day. And what's interesting about that case is it's only for November elections and even years, because that's a date that's set by Congress because it's a federal election. So for some reason, the Supreme Court said, oh, we do agree with the RNC. They have to be in the office by 8 o'clock on election night. Then it would only be applicable to that particular type of election. And if the state, if Oregon state decided not to change back and have the same, we might have different rules depending on what kind of election that we were conducting. And so it is causing a lot of confusion. The important thing to know though is that for this election, postmarks do count, but we do ask you to get your ballot in as soon as you're ready to vote. That way we can count it and have it be part of election night results reporting.
And so Catherine can't say this, but the person who's running against her is a precinct person for a party who has testified in our state against vote by mail. Just gonna put that up front.
So, I just don't wanna see our counties filled with a bunch of people who are elected, who are against our current, systems.
Well, one of the questions that runs in my mind is that if that should go into effect for federal elections,
Yes.
so is it possible that Oregon or the county or however could give people some extra time, like the ballots would go out earlier?
Well, if ballots went out earlier, we'd have to have candidates file earlier. And right now, the filing deadline will happen, and then we're scrambling to create the voters pamphlet, the ballots.
Right.
We have to mail ballots out 45 days before election day for military and overseas, so we're mailing ballots out, say October again, geez, April 2nd, for military and overseas voters. So if we wanted to create more time for folks to receive ballots, like we want to mail them out 3 weeks instead of, well, we do mail them out 3 weeks, let's say we want to do it a month beforehand, we'd have to adjust the rest of the schedule too.
Yeah.
And that would all have to be done through statute.
You said 23 positions are being challenged? People running?
So there's 19 people who filed for office. Yeah, so there's 3 commissioner positions, the justice of the peace, the tax assessor, the treasurer, the clerk, and somebody else that I'm forgetting, and I feel bad about.
But 15 are running for commissioner?
15 for 3 commissioner positions, yes.
Okay, we have a question online. Who's that?
Tom Hogan? Yeah.
Is that me?
Yeah.
I have an announcement, everybody.
Oh,
The
good.
Gladstone Oak Grove Kiwanis Club is sponsoring our annual spaghetti dinner. And it's going to be at Oak Grove United Methodist Church on May 9th, 5 to 7. And it's a fundraiser. It's a fundraiser for the high school key clubs that we support. And a key club is a club that teaches and encourages high school kids to do service. So it's really doing service and hands-on for them. It's the kids are inspiring. Every time that I see them, what they're doing, I'm inspired. So, well, we have a flyer, and if I could send you the flyer, Valerie, that would be great if it could go out.
Absolutely.
Okay.
Send me the flyer and I'll send it out to the community.
Yeah. Okay. It's a great dinner. We have a great cook. So, spaghetti, meatballs, garlic bread, salad, spumoni ice cream.
Great. Thanks so much, Tom.
Yeah.
Any other announcements? Good of the order?
I'll just say one more on the next Milwaukee Community Free Store at Letting Libraries on April 19th from 10:30 to 1. And then following that, it'll be the 3rd Sunday at City Hall because
So what was the first date?
April 19th. So it's the 3rd Sunday of the month. We've been at Letting Library, but when the market starts up, we'll be at the City Hall and we'll be expanding our hours.
Okay, great.
Do you take toiletries and things like that? Like
We take
shampoo
toiletries, we love toiletries, weather appropriate clothing. Just keep in mind, anything that doesn't move usually ends up in my garage, so please don't bring dishes and those sorts of things. We are working on, probably late June, a free flea market is what we're working on, so people can bring that kind of thing. And then take it away if it doesn't get taken. So we've got a group working on that. So, yeah.
All right, well, I think that's it, so I will officially say the meeting is adjourned. Thank you to everyone who was here online. And I want to say thank you to Ben for a great tech job, being able to bring up the websites and whatnot. That's very impressive. Thank you.